What is a stroke? A stroke is a serious medical condition that occurs when the blood supply to the brain is interrupted, either by a blockage, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. This deprives the brain of oxygen and nutrients, which can damage brain cells over a short period of time. If not treated promptly, a stroke can lead to permanent disability or even death. Signs and symptoms of stroke. Symptoms of stroke often appear suddenly. Recognizing the early signs is essential so that sufferers can receive medical care immediately. Main symptoms of stroke. 1. Weakness or paralysis. One side of the body feels weak or numb, especially the face, arm, or leg. This condition often only occurs on one side of the body. 2. Speech and comprehension disorders. Difficulty speaking, slurred speech, or difficulty understanding others. 3. Vision disorders. Blurred, double, or dark vision in one or both eyes. 4. Balance and coordination disorders. Sudden dizziness, loss of balance, or difficulty walking. 5. Sudden headache. A severe headache with no apparent cause, often accompanied by nausea, vomiting, or fainting. Early warning signs. Fast, face. The face appears to droop on one side, especially when smiling. Arms. One arm is weak or difficult to lift. Speech. Slurred speech or difficulty understanding conversation. Time. If these symptoms occur, seek medical attention immediately. Mild symptoms that could be early signs. 1. Tingling or numbness in the hands or face. 2. Sudden mild dizziness. 3. Difficulty concentrating or feeling confused for no reason. Causes and risk factors of stroke. Stroke can occur due to various factors, both modifiable and non-modifiable. Main causes of stroke. 1. Ischemic stroke, caused by blockage of blood vessels to the brain due to blood clots or cholesterol plaque. 2. Hemorrhagic stroke, caused by rupture of blood vessels in the brain, often due to high blood pressure or aneurysm. 3. Transient ischemic attack, TIA, a mild stroke that occurs temporarily, but can be a warning of a more serious stroke. Stroke risk factors. 1. High blood pressure, hypertension, the main cause of ischemic and hemorrhagic strokes. 2. High cholesterol, causes plaque formation that clogs blood vessels. 3. Diabetes, increases the risk of blood vessel damage. 4. Smoking, disrupts blood flow and increases the risk of blood clots. 5. Obesity, associated with high blood pressure, diabetes, and high cholesterol. 6. Lack of physical activity, increases the risk of cardiovascular disease. 7. Family history, the risk of stroke is higher if a family member has had a stroke. 8. Excessive alcohol consumption, can increase blood pressure and the risk of brain hemorrhage. Stroke prevention methods. Stroke prevention involves lifestyle changes and management of underlying medical conditions. 1. Control blood pressure. Keep blood pressure normal, less than 120/80 mmHg. Avoid foods high in salt and fat. 2. Eat healthy foods. Consume foods low in saturated fat, cholesterol, and salt. Focus on vegetables, fruits, whole grains, and healthy proteins. 3. Exercise regularly. Do at least 150 minutes of physical activity per week, such as walking, swimming, or yoga. 4. Quit smoking. Smoking can double your risk of stroke. 5. Limit alcohol consumption. Avoid alcohol or limit alcohol consumption according to medical advice. 6. Manage diabetes and cholesterol. Monitor blood sugar and cholesterol levels regularly to prevent complications. 7. Manage stress. Do relaxing activities, such as meditation, listening to music, or pursuing a hobby. Stroke treatment. Stroke treatment depends on the type of stroke experienced and how quickly the patient receives treatment. 1. Ischemic stroke treatment, blockage, blood-thinning medications, aspirin or anticoagulants to dissolve blood clots. Thrombolysis, giving thrombolytic drugs to dissolve blood clots within 4.5 hours of symptoms appearing. Mechanical thrombectomy, a medical procedure to remove blood clots from large blood vessels in the brain. 2. Hemorrhagic stroke treatment, blood vessel ruptured, blood pressure control. Medications are given to lower blood pressure and stop bleeding. Surgery, performed to repair damaged blood vessels or reduce pressure on the brain. 7. Manage stress. Do relaxing activities, such as meditation, listening to music, or pursuing a hobby. Recovery after stroke. After a stroke, rehabilitation is needed to help patients recover their body's abilities. 1. Physical rehabilitation, therapy to restore movement and strengthen weak muscles. 2. Speech therapy, helping patients overcome difficulties speaking or swallowing. 3. Psychological support, overcoming stress, depression, or post-stroke trauma. 4. Lifestyle changes. Patients are advised to live a healthy lifestyle to prevent recurrent strokes. Conclusion. Stroke is a serious condition that requires immediate treatment. Recognizing the early signs of stroke can save lives and reduce the risk of complications. By adopting a healthy lifestyle, controlling risk factors, and seeking medical help immediately when symptoms appear, the risk of stroke can be minimized. If you or someone close to you experiences symptoms of stroke, contact emergency services immediately for fast and appropriate treatment.